Hey, everyone. Welcome back to Safari Veterinary Care Center. Today, we're diving into a unique and essential procedure, the laryngeal paralysis stent placement. This procedure helps dogs suffering from breathing issues due to laryngeal paralysis, giving them a better quality of life. Laryngeal paralysis is a condition where the muscles and nerves that control the larynx or voice box stop functioning properly. This prevents the airway from opening fully, causing breathing difficulties, noisy breathing, and even chronic coughing. Dogs with this condition can struggle to breathe, especially during sleep or physical activity. Today, we're going to walk you through the process of placing a laryngeal stent. Although it's not considered surgery in the traditional sense, it's an incredibly valuable procedure for dogs suffering from laryngeal paralysis. The stent works by keeping the airway open, helping the dog breathe easier. We've actually performed this procedure before, but due to some technical issues, we couldn't show it live. Now, we're excited to walk you through the process in detail and show you exactly how we help dogs breathe better through this minimally invasive technique. Laryngoscope, a small camera that allows us to look directly into the dog's throat. This tool gives us a clear view of the dog's airway, including the vocal cords and the larynx. With this visual, we can confirm the diagnosis of laryngeal paralysis and plan the stent placement. Our patient today has been experiencing chronic coughing and noisy breathing, particularly during sleep. Other vets suspected laryngeal paralysis, and today we're here to confirm it and take action. Preparing the stent. Once we confirm the diagnosis, the next step is to prepare the stent. This small device is designed to keep the dog's airway open, preventing the collapsed cartilage in the larynx from obstructing the airway. The stent we use is flexible, which allows it to be carefully inserted into the correct position. Our veterinarian, often referred to as Doc, has created this stent to perfectly fit the patient. The stent will be placed directly inside the airway to help keep it open, allowing the dog to breathe more easily. Placing the stent. Now it's time to place the stent. Using the laryngoscope, we carefully guide the stent into position inside the dog's throat. It's important to note that while the dog is awake during this part of the process, it's kept calm and comfortable with the help of our veterinary assistants, who are gently holding the dog's mouth open. Our team, including Owen and Lacey, are working together to make sure everything goes smoothly, holding the dog in position while Doc carefully inserts the stent. Visualizing the stent placement. Now, let's take a closer look at the screen. You can see the live feed from the laryngoscope showing the inside of the dog's throat. This live visualization is essential for ensuring the stent is placed correctly and that it fits perfectly inside the airway. The goal here is to make sure the stent holds up the collapsed cartilage, keeping the airway open. You'll notice the soft pink tissues inside the throat and how the stent fits in snugly, giving the dog a clear path for air to flow through. Adjusting the stent for comfort. As the stent is placed, adjustments may be necessary to make sure the dog is as comfortable as possible. Doc is very careful at this stage, making small adjustments to ensure that the stent doesn't cause irritation or discomfort. It's essential that the dog is able to breathe normally without feeling any pressure or pain from the stent. These fine adjustments may take a little bit of time, but they're important for ensuring that the stent fits perfectly and provides the long-term benefits the dog needs. The importance of precision. Every dog's anatomy is slightly different, which is why precision is key when placing the stent. Doc takes his time to ensure that the stent is not only in the right position but is also fitted correctly to the size and shape of the dog's airway. This ensures the best outcome and long-lasting relief for the dog. Remember, these procedures require patience and careful attention to detail. It's not just about getting the stent in place. It's about making sure it's comfortable and effective. Finalizing the procedure. Once Doc is satisfied with the placement, we move on to the final checks. Using the camera, we confirm that the stent is doing its job and that the airway is open and functioning well. The dog's breathing is carefully monitored to ensure everything is working as expected. With the stent in place, the airway remains open, allowing the dog to breathe freely without the obstruction caused by the collapsed cartilage. This relatively simple procedure can have life-changing effects for dogs with laryngeal paralysis. Post-procedure monitoring. After the stent is placed, we move the dog to recovery. Post-procedure care is crucial to ensure that the dog adjusts well to the stent and that there are no complications. Owen and Lacey will keep a close eye on the dog's breathing and overall condition as it begins to wake up from the light sedation. It's also important to note that while the stent is designed to stay in place permanently, regular checkups will be scheduled to make sure it's functioning correctly and that the dog continues to breathe normally. Understanding laryngeal paralysis. Laryngeal paralysis is most commonly seen in larger dog breeds, though it can occur in smaller dogs as well. Breeds like Dalmatians, Siberian Huskies, Rottweilers, and American Staffordshire Terriers, like today's patient, are more prone to this condition. Common symptoms of laryngeal paralysis include noisy or raspy breathing, excessive panting, coughing, gagging, or changes in the sound of the dog's bark. If your dog is showing any of these signs, it's important to get them evaluated by a veterinarian, bringing in the C-arm for X-ray confirmation. To make sure the stent is perfectly placed, we use the C-arm, a special type of X-ray machine that gives us real-time images of the stent inside the airway. This extra step helps us confirm that the stent is positioned correctly and that it's functioning as intended. On the screen, we can see the stent as the dog breathes. This gives us the assurance we need that the procedure was successful and that the dog's breathing will improve significantly. With the stent in place and the procedure complete, our focus now shifts to the dog's recovery. Most dogs show an immediate improvement in breathing, and within a short period of time, they're able to return to their normal activities. This stent placement may not be as invasive as other surgeries, but it can still have a dramatic impact on a dog's quality of life. We'll continue to monitor the dog during recovery and provide the necessary aftercare to ensure a smooth transition. Thank you for joining us for this in-depth look at laryngeal paralysis stent placement. At Safari Veterinary Care Center, we're dedicated to providing advanced care for pets with conditions like laryngeal paralysis. If your dog is experiencing breathing difficulties, don't hesitate to reach out to us. Stay tuned for more behind-the-scenes videos of surgeries, procedures, and even some grooming tips. And remember, if you have any questions, feel free to ask us in the comments. Thanks for watching, and we'll see you next time.